Passing DNB Pediatrics after MD is not about just their knowledge theory. It's a strategy. So as a hearing, DNB Pediatrics is very difficult. I'll be explaining the simple way how I cleared my DNB exams in the first attempt as one of the toughest exams among the DNB. So without further delay, let's enter. Why DNB after MD? So as a hearing, DNB Pediatrics very difficult. The passing rates are very low. So I want to give challenge. And DNB is a national recognition. It's conducted by NBEMS. So it's a good as like the MD. And your MD students will be getting additional qualification with your degree. It adds additional weight for teaching academics or abroad. There will be common myth that DNB Pediatrics is tougher and difficult than MD to clear. And second, how DNB Pediatrics is differ than the MD. First of all, the passing rate in the DNB Pediatrics is so low than compared to MD Pediatric examination. The pattern will be different. Evaluation is strict and practicals in the DNB is so challenging that these practicals will be conducted in unknown places by unknown examiners with unknown cases. You have to travel with the allotted centers and you have to adjust and give examination. This will be very challenging in the DNB exams. That will be not a problem in our DNB exam structures. So exam will be similar like MD. There will be theory and practical, but only differ will be, first of all, you have to clear your theory examination. After that, if you clear theory, then only you are going to allow to write the DNB Pediatrics practical. There are 4 papers like MD, but only difference will be the papers are continue, the patterns will be changed, there will be no gap and there will be no clear-cut topic demarcations in the DNB. In practical, as I told, this is very challenging. This contains 3 parts. OSCE components will be there, cases will be there, and YY will be there. Among total marks will be 300 marks of practical and 400 marks of theory. Yeah. So I'll be sharing strategy to clear your theory exams. 70 to 80% the syllabus will be same, topics will be similar. The only difference, the way of asking the questions will be different. If you read the previous 5 to 10 year questions, this solution, you will get a solution. Focus on last 5 to 10 year question bank. From question banks, also you can read from dnbpediatrics.com. Both source I attach in my description box, you can go through. And very importantly guys, you are focusing less on some topics which are very important for DNB Pediatrics. PSM, stat epidemiology questions, nutrition, immunization, growth development, dermatology, IP guidelines are very important. The final paper will only contain the updates. For this, you have to read some recent guidelines, articles and journals. Topics also asked in MD. If you thoroughly you practice, there is nothing to worry about this. During the theory examination is relatively easy compared to practical. If you read in your residency, if you have made a notes, you have to revise before the theory examination, will be definitely clear. And one more plus point will be there, DNB exams will getting 2% of grace marks will be provided if you cleared your MD exams in pediatrics, will be getting around 2 to 3 months plan to give your DNB. For giving DNB examination, just you have to need a provisional certificate or degree certificate from MD. You have to look for previous at least 5-year question banks. That really helps. guys, because the DNB questions repeats more. We'll get an idea about the pattern, which topics are very focusing, which are very important, which are least important, in what way the questions are asking. We'll get an or 1.5 before the exam start. First you have to look for your previous questions. You can get idea which topics are never read, which topics are least read, which topics are very important but that I missed in my MD exams. First you have to read and make a notes, because whatever read topics you can read, without reading also you can write, but unread topics are very important because this. And for preparation guys, don't change any sources. Whatever the preparation you made for MD exams, stick on this. If you have a notes, stick on this. If you read textbooks, stick on this. Just remember what are topics are read in what books. So for theory examination, there are 400. Out of 400, you have to minimally you have to get a 200 marks to clear, and each paper you must need a 40 marks to qualify. Total aggregate marks will be becomes 200 to clear your theory pediatric examination. After clearing theory examination only, you're going to allow for to give DNB Pediatrics practical. DNB Pediatric practical examination will be mainly 3 to 4 months after theory examination, for example. So now strategy to clear DNB Pediatric practical examination, because this is very challenging. For practical preparation, you already prepared your cases and spotters. Some MD examination only guys. The only you need the revision. You can prepare the practical after the theory examination completed. So only challenging will be OSCE, because OSCE is the main big sword in your DNB practical, because it only compromises 100 marks. The practical mainly contains 3 parts: OSCE 100 marks, the cases 50-50 100 marks, and remaining what wrong with Viva having 100 marks. The only specifically you have to read the OSCE. For OSCE, you can read Manoj Kumar Sharma, Scott Pediatrics, and OSCE in Pediatrics books are there. You can refer anything. So OSCE mainly contains clinical questions, some image-based questions, some single lines. Each question will be having a 4 to 5 sub questions are there. Have a limited time. That will be there will be 2 cases. One will be neuro case, one will be non-neuro case. Non-neuro case includes any case. So if you are perfect in all cases, as in residency or so this is my personal experience how I cleared my DNB pediatric examination in my first attempt with a good marks after MD. I cleared my MD exams in December month. So there will be DNB exams in the June month. I registered for DNB examination. For this, what are documents required? I attached it in the description guys. Prepare for exam. How I balance my both work and study. Along with my senior residency, not regularly, because in my 24 hours I cannot read. Only within that gap only I am reading. Because my plus point was that I having my notes which I prepared for MD. Have that confidence. In the last 1 month, I just revising the notes, one revision, and one revision, as I told, I finished 1 week before the examination. The common mistakes you should avoid: don't be overread, just specific and focus on your previous questions, mainly on the topics, because the questions will not repeat, the topics will be repeat. So focus on the topics. If you have any topics low, if you're not confident, read topics, previous year questions, smart strategies, and revision. So because after you have done one exams, it's very hardly to get again motivation to write exam and clear examination. For this only how to need guys, planning is very important. You made a plan within 1-2 months, and according to your time specifications, when you are getting free, when you have duty, make a plan. Read one topic and two topics, one questions. One topic is very important. You finish one. I cleared my DNB examination very nicely. After this, there are 3 months gap will be there. I prepared among these practical examinations. I cleared practical also. So having a additional extra degree. If I can do, you can also do. So this video for all MD students, DCS students, or DNB students also. So want to give the DNB pediatric examination. You can bust the myth that DNB pediatrics practicals are very. This is a myth. If you prepared smartly, I also made video on the how to prepare for practical exams separately, and to prepare theory exams also separately. You can go through these videos also, guys. This is very important and get a extra knowledge. If you have any query, comment in the comment box. I'm very glad to give an answer to your comments. Please share this video. Your friends, your residents, your juniors and your seniors who want to write your DNB pediatrics examination, who are preparing for DNB examination. So thank you guys. Bye. Goodbye.